Now, while institutions of higher learning debate mandatory vaccinations, Higher Health says university and college students could be required to produce negative COVID-19 tests before attending contact classes. Higher Health is the development center that plans and implements health and wellness programs in post-school education and training. The sector may also introduce 72-hourly or weekly COVID-19 testing for all unvaccinated people. To tell us more, we're joined by Professor Ramneek Ahluwalia, who joins us this morning virtually. Prof, thank you very much for your time. Now, we know that in a country like South Africa, taking a vaccine is not mandatory. But of course, institutions of higher learning and even companies are finding ways and loopholes to try and see if they can convince people to get their vaccine. Is this one of those ways to try and get people to get the vaccine?
Thank you very much and good morning. You're absolutely right, but before even we go into that route, I think it's very important for the viewers to understand that we're still very early stages. While these discussions are pertinent, we're just about 2 to 3 weeks only towards maturing our vaccination program. And it's still very early, when you are in 2 to 3 weeks and we are expecting more and more people to make their mind and come up and get a needle in their arm, which is scary, and vaccines are critical for us. So I think in the infancy stages of our maturity of our vaccination program, as much as these things are very important and very healthy for our discussions, but I think it's still very early stages to discuss questions like mandatory vaccination, soft incentivization, or even issues like what we call about making testing a possibility, because this is one of the aims to promote vaccinations. And so what we're trying to do right now, and speaking to every young person, is to make their minds and convince them that vaccine will save South Africa. Vaccines will save, will be such an important tool, because South Africa is a youth country and Africa is a youth continent. If we can vaccinate young people in South Africa, in this stage, this can define the trajectory of this pandemic within our continent and our country. And I think all these methodologies are trying to figure out how do we get our youth to vaccinate.
Now, if universities and institutions of higher learning, Prof, decide to have these weekly or daily vaccines taking place, isn't this a nightmare in terms of finances?
First of all, vaccines, what we've done is we've established, we'll be following a three-pronged approach. So first, we've established vaccine sites across our institutions of higher learning, which are already in existence. About 17 universities are already accredited vaccination sites, and we have storage facilities, and things are running quite smoothly as we speak about. Parallelly, all the other universities and over 22 TVET colleges, we have now established vaccine points. When we speak about vaccine point, we might not have excessive infrastructure of storage, but we're bringing vaccines on a daily basis from the nearest point into our sites. All these efforts are done to bring easy access of vaccination at the doorsteps of young people. They don't miss classes, they don't miss exams, they can get easy access of vaccines. But when you talk about testing, and which is why you were raising the question that should we be putting testing, a weekly testing for people who are unvaccinated? Again, these questions will only be coming into severe discussions, say in 2 months' time from now, when people would have been given enough time. And as I said, startingly, this is too early. This is still 3 weeks into our vaccination program. It's getting maturity into and people given enough time to make decisions on getting vaccination. But once vaccine hesitancy becomes too much for us to bear, then we have to look into soft incentivization, methodologies like weekly testing. And these are mechanisms that will keep promoting young people to go and vaccinate, or people to go and vaccinate.
I know that you're saying that this is a conversation that can only happen after we've given people time and after we've given ourselves some time to see if hesitation is still a problem. But if we find, Prof, that hesitation is a problem among young people, would it not be a financial nightmare either for the universities or the pupils themselves to have to get tested? Wouldn't it be better to just get vaccinated?
So, the aim is nobody wants At this stage, everyone from the scientific world, from the leadership perspective, from everywhere, the ask is, let's get vaccinated. We clearly know that if people are getting vaccinated, we can really stop the transmission, the way the virus moves from one person to the other. And parallelly, when it keeps having a high transmissibility, it has a high possibility of finding a human body and mutating and developing variants. And for us, the cry is, how do we quickly vaccinate as many South Africans as early as possible to break the chain of this spread and transmissibility of the virus, the possibility of the fourth wave looming in front of us, our third wave, which is still not over. And these are all challenges that remain on our country's economy and our systems as I speak to you. And these measures, which are called measures which we're talking into mandatory vaccinations versus incentivizations versus issues of putting testing on for not vaccinated people to mingle with vaccinated people in a congregate setting. Remember, we've got classrooms, we've got residences where people are living and residing together in spaces. So when the economy has to open, these will only be decisions by that time to see how far are we with our vaccination program. If you look at United Kingdom now, if you look at United States right now, they have been able to vaccinate over 50 to 60% of their population fully vaccinated, which means they've been able to open the economy in such a way, their institutions in such a way that people are able to live with this virus. As much as the virus is spreading, the virus is having infections, but the virus is far tamed down. And it's become like a milder or a moderate kind of an infection, which we live with that flu irrespective on a seasonal basis. So taming this virus is only possible if we can get to that number of population that we can vaccinate. And I think, as I said, a month or 2 months from now, when the maturity of our vaccine program will take place, we will keep looking at, we are seeing vaccine hesitancy, but we also believe people have to be given time to make their decisions. It's not an easy decision, and one has to respect. But vaccine promotion, telling people the reality of the science of why it is, will push them into vaccine sites, making it more youth-friendly, making it easy access for them, will give us more advantages. And I think at this moment, our whole mindset is vaccine promotion, easy access of vaccines, making vaccine readily available, and keep pushing to make people understand. And I think maybe going forward is exactly, we will reach a stage where UK and US are making decisions, and those similar decisions might imply into a South African economy to open up.